All right. Good morning, everybody. Sunday morning. Good morning, everybody. Sunday morning. I think there's a little bit of a glitch going on with the live broadcast. The computer seems to be throwing a bit of a fit. I'm not entirely sure how to interpret what the screen is telling me, but I'm just going to sort of go with it. So, March 22nd, 9:37 in the morning. A bit of a late start for me today, but what can I say? A little bit of a relaxed vibe is usually what I go for on Sundays anyway. It's been that way for a while. I tend to try to reserve Sundays for enjoyable recreational activities, etc. Um, Sunday was my day to go skiing before all the resorts shut down. During the summer, Sunday is usually when I would go out and take my buddy fishing or something like that. There may be some of that today, although I'm not entirely sure I'm feeling that today because I've got my own projects to work on. And also, I've been informed that the HR department for my company is projecting that this closure of our store could extend all the way to mid or even to late April. So we could be looking at another month of this. And I've only just completed my first full work week without having a job to go to. So this really looks like it's just the beginning of of that. However, there has been some development um, in terms of being able to bring into focus how exactly I'm going to get over this, and other people who I work with at that job are going to get through this financially. And so there is a structure in place to take us safely to the other side of this whole thing, wherever and whenever that may be. And there's also action being taken by the federal government, which I'm going to get into in further detail a little bit later on. But just to get this whole thing started today, I'm going to go ahead and give you an update with the latest figures of COVID-19 cases and fatalities. So it looks like in the United States, as of today's date, in the United States, we've got 27,630 confirmed cases and 349 deaths. The latest updates that I have been able to find indicate that as of today's date, in the United States, there are 3,423 new cases and 47 new deaths. It looks like the state with the most new deaths is Georgia at 6. 4 new deaths in California, including the first death in Monterey County. 4 new deaths in Louisiana, 3 new deaths in Michigan, and then Florida, Colorado, Virginia, Indiana, Kentucky, and Kansas are all reporting 1 new fatality each as of March 22nd. So let's look at what's going on here locally in Washington State. As of the 22nd, Washington State has a total number of 1,793 positive or confirmed cases and 94 deaths. Bringing it in a little closer to home, as usual, Pierce County, where I live, 95 positive or confirmed cases as of today, and we're still sitting at 1 fatality. King County continues as the hardest hit, 934 cases with 74 fatalities, and Snohomish County, 447 confirmed cases and 10 fatalities. So that's where we are with the numbers as of right now. So yesterday I made an enthusiastic commentary with respect to a potential drug that has shown some kind of effectiveness against the virus. Now, upon further reading, I don't have anything to amend from what I said. However, extrapolating how that's going to move forward and what it means more broadly is a situation which has invoked some considerable debate and sensationalism through various media outlets. I came across headlines from outlets such as Vox, who say that the president continues to promote a drug that is unproven and dangerous as a way to fight coronavirus. Now, that kind of spin is something I've come to expect from outlets such as Vox. But it is worth pointing out that there has been some factual and statistical pushback against the idea that this combination of drugs to which I alluded yesterday should be looked at as a magic cure or some kind of wonder drug within this pandemic. And I'm going to go ahead and jump to that next up. So, Dr. Anthony Fauci is currently the director of the National Institute of Allergy and Infectious Diseases within the government, and at a press conference with the coronavirus task force at the White House yesterday, Dr. Fauci did address this combination of drugs, which the president mentioned in a tweet yesterday morning. So I'm just going to read from his statement, which has been transcribed and released through whitehouse.gov. I'm not going to read the whole thing, but he mentioned with respect to the drug that the way that you prove the effectiveness is to do a randomized control trial and prove safety and efficacy. And he goes on, I'm not totally sure what the president was referring to, but I believe he was referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being an effect. Many of the things that you hear me, strangely phrased, many of the things that you hear me out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The president is talking about hope for people, and that's not an unreasonable thing, to hope for people. So when you have approved drugs that physicians have the option and a decision between the physician and the patient, are you going to use a drug that someone says, from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job as a scientist, to say my job is to ultimately prove without a doubt that a drug is not only safe, but that it actually works. Those two things are really not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven. We went through the same sort of thing with a little bit of a different twist during the HIV/AIDS epidemic until we finally developed drugs that were absolutely knockout drugs that were safe and that were effective. But in the beginning, there was that tension about that. So you really got to have a balance. So I guess it's worth pointing out that it's important to temper our expectations with the immediate emergence of any drug or combination of drugs, because as the doctor pointed out, these are anecdotal. The drugs haven't been put through the proper type of tests, which could give them more of a veneer of an effective and universal cure or treatment for this, because as yet this combination of drugs has not been proven in that manner. So it's still progress. It might not be the cure that we've all been waiting for, but it's still progress, and I hope that it gets. I hope this whole thing moves forward, and that this combination of drugs will prove to be more effective than just a couple anecdotal cases out of France. But it's not to say that we shouldn't be hopeful. So I came across an interesting story that the World Health Organization spread false Chinese government propaganda. being that the coronavirus was not contagious among humans. This is a story from today's date. I'm just going to sort of dig right into this. I don't really have a cogent opinion about it formed, but this is kind of interesting. It says World Health Organization Twitter messages from January and February show that the United Nations body was spreading Chinese propaganda. Health officials detected the first case of COVID-19 on November 17th in Wuhan, China. Communist officials in China hid the extent of the coronavirus outbreak during the early stages of the epidemic, jailing and silencing whistleblowers, a move that allowed the virus to gain a firm hold. The ruling Communist Party, however, has hailed the recent slowdown of the outbreak as a sign of the superiority of its authoritarian political system. A study published earlier this month by the University of Southampton determined that China would have prevented 95% of the coronavirus infections plaguing the globe if Beijing had listened to the doctor whistleblowers in Wuhan about the seriousness of the disease instead of silencing and punishing them for speaking out. Quote, at critical moments, officials chose to put the secrecy and order ahead of openly confronting the growing crisis to avoid public alarm and political embarrassment. That's from the New York Times, acknowledged in early in February. China has refused to apologize for its mishandling of the outbreak during its initial phase. Meanwhile, it appears that the World Health Organization has been covering for the ruling Communist Party in China. On January 14th, the day before the first case to reach the United States reportedly flew from Wuhan to Seattle, Washington, the World Health Organization denied that the disease was spreading through human-to-human transmission. Quote, preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus identified in Wuhan. That was something the World Health Organization wrote on Twitter at the time. It took the World Health Organization a few days to finally concede on Twitter that person-to-person transmission was indeed possible, but it continued to downplay the threat for several days. On February 4th, the United Nations body cast doubt on assertions that asymptomatic persons infected by coronavirus could transmit the disease. Although coronavirus had been traced to an animal market in Wuhan by late January, the World Health Organization claimed in early February that it did not know the source of the outbreak. As of February 11th, the World Health Organization was still casting doubt on assertions that the virus originated from animals in China. On February 14th, the World Health Organization tweeted that the body's director, Dr. Tedros, I can't pronounce that name. I'm not going to try. The director of the World Health Organization had pushed back against critics who denounced him for commending China's response to the virus. So essentially, this article goes on to draw connections between the head of the World Health Organization and Communist China's government. So it appears that the way this whole thing was handled and the information being put out very early on, and the way that the Chinese government was cracking down on people who had valid and actionable information about it at the very beginning, has been called into serious question and is being subject to very serious criticism. Because had it been handled differently, as far back as November of last year, then there is every reason to believe, in retrospect, that the way that this whole thing has spread could have been very, very significantly curtailed, and that we might not currently be facing this global crisis that we're in, had this situation been handled by the Chinese government much differently than it was. Of course, again, this is all in retrospect, and we are where we are. So life continues, is this sort of surreal, it almost feels like a dream that we're in. Everything has come to a grinding halt. People are not being allowed to go to work. People are being discouraged from gathering in groups of more than 10. Now, there's not been, within the state of Washington, any direct order from the governor to stay home. However, the number of states that have imposed those kinds of restrictions on people, I think it's got up to 5 or 6 Washington is not yet among them. The governor's latest statement that I've been able to find with respect to a statewide lockdown is that he's not going to legally impose those kinds of conditions on the state of Washington, but he is pleading with people to stay home and sort of respect the seriousness of the situation by voluntarily self-quarantining. Give me just 1 second here. I'm going to find the list of states who have imposed these conditions. The first one of which was California. New York also has. New Jersey also has. And then there are 2 or 3 others. Give me 1 second to find that. I printed off all kinds of documents before starting today, but didn't think to print that one. So let's see here. States which have imposed lockdowns. Okay. Okay, this from 4 hours ago. Where am I? Oh, the first thing to come up was from Al Jazeera. Well, how about that? Okay. Oh, this is just an alphabetic state by state. I'm not going to go through all that. Suffice it to say, the response is, just like everything else, is the development of this response is ongoing and fluid, and we'll just see how everything shakes out for the state of Washington. I really hope, for everybody's sake, that we're not legally compelled not to leave our homes. That would make life even more boring. Not to downplay the seriousness of it, but good Lord. And I do think it's interesting that most of the states who have imposed these conditions don't have as serious a case of dealing with the coronavirus as Washington does. Washington state is certainly dealing with Oregon, I believe, is one of the states that's imposed a mandatory statewide lockdown, but they're not dealing with nearly as serious of an outbreak statewide as Washington is. So as of yet, we are not being forced to stay at home. So I want to shift gears a little bit now to the way that the federal government is trying to handle the financial impact that all Americans are going to be feeling from this. So as of today, Congress is trying to pass something called the CARES Act. This is something that was introduced by, I believe, Mitch McConnell and several other senators. So it's S-3548, the CARES Act. This is about getting money directly to American citizens to help them out through this. So this is the summary of that legislation. The Coronavirus Aid, Relief, Economic Security Act, or the CARES Act. This bill addresses economic impacts of and otherwise responds to the COVID-19 outbreak. The bill authorizes emergency loans to distressed businesses, including air carriers, and suspends certain aviation excise taxes. With respect to small businesses, the bill establishes and provides funding for forgivable bridge loans and provides additional funding for grants and technical assistance. The bill also provides for $1,200 tax rebates to individuals with additional $500 payments per qualifying child. The rebate begins phasing out when income exceeds $75,000 or $150,000 for joint filers. The bill establishes limits on requirements for employers to provide paid leave. With respect to taxes, the bill establishes special rules for certain tax-favored withdrawals from retirement plans, delays due dates for employer payroll taxes and estimated tax payments for corporations, and revises other provisions, including those related to losses, charitable deductions, and business interest. With respect to health care, the bill provides additional funding for the prevention, diagnosis, and treatment of COVID-19, limits liability for volunteer healthcare professionals, prioritizes Food and Drug Administration review of certain drugs, allows emergency use of certain diagnostic tests that are not approved by the FDA, expands health insurance coverage for diagnostic testing, and requires coverage for preventative services and vaccines, and revises other provisions, including those regarding medical supply chain, the national stockpile, the healthcare workforce, the Healthy Start program, telehealth services, nutrition services, Medicare, and Medicaid. With respect to education, the bill temporarily suspends payments for federal student loans and otherwise revises provisions related to campus based aid, supplemental educational opportunity grants, federal work study, subsidized loans, Pell Grants, and foreign institutions. The bill also authorizes the Department of the Treasury to temporarily guarantee money market funds. So, this is sort of an overview of the way that the federal government is attempting to combat the financial impact of what's happening to us as a result of this pandemic. So that's essentially all the factual information that I've brought together for today's little broadcast. Just an update, really. That's all we can do, is just sort of try to monitor this thing in real time, keep a finger on the pulse of it. You know, when I do spend time going out and hanging out with my friends and trying to pass the time, and I listen to the way that people are talking about this, a lot of the things that I hear people say, especially with respect to how the government is going to affect our personal lives, they're not based on fact. It's being seen by some of my friends as just a way, like an opening to impose some kind of martial law on all of us. It's being portrayed by some people as a way to bring the American economy to a grinding halt and to disrupt everybody's lives, to intentionally shut our country down. And there's all kinds of speculation as to what's motivating this. A lot of it is purely political. Some people are still seized of this idea that there is an invisible world government that's trying to control everyone's lives for some nefarious goal. I tend to, as I've said before, I tend to shy away from that kind of sensationalism. It's really easy to let yourself get carried away when you're faced with a situation that you don't understand and haven't experienced. And this certainly is, again, unprecedented. So there's going to be a lot of nervous people out there, a lot of angry people out there, people who really, really just want to get back to their lives. And imaginations are spinning out of control within the minds of some of the people I hang out with. I'm not going to criticize them. I have my own opinions about what's going on. But I think the most important thing to do is to have as solid an understanding of what facts are available as you can. And just keep in communication with everyone around you. Be good to each other, as I keep saying every day. And this is going to blow over. We're going to get through this. With all the spare time that I have, I'm continuing to contemplate just hitting the road. I might have to put certain things, certain projects on hold if I'm going to do that. But I've been, for many years in my own life, daydreaming about going back to certain places where I used to live. Some of these places are many thousands of miles away, like Alamogordo, New Mexico. I can't believe how much time I spent thinking about that little town. I mean, I moved out of there in, I think, 1988, and I was still a real little kid. But I really want to see this town again. What's to stop me at this point? Although, with Oregon now having imposed a statewide lockdown, I don't know. I was thinking about driving down to Crater Lake. That's about a 7-hour drive. The collapsed caldera of a volcano that was at one time the same size as Mount Adams and is now just a giant hole in the ground full of water. I've seen a lot of pictures of it, but I want to see it with my own eyes. Pictures don't tend to do justice to things of the scale and magnitude of these mountains that are out here. So that might be interesting to go and do. Who knows? There definitely is a lot of good reason to stay here and sort of wait to see how this whole thing unfolds, right? I guess I'm going to leave things there for now. It looks like I'm approaching 25 minutes of broadcast, and I want to get on with a day. You know, there was talk of going out fishing. That might be fun. You know, stay with my close friends and try to do something enjoyable and productive. But I don't know. At any moment, I might just jump in my Explorer and hit the road. So if I do that, I'll take my cell phone with me and I'll just sort of update people remotely as best I can. This can be viewed as an opportunity, right? So anyway, I'm going to go ahead and leave things there. I'll keep everybody updated. Be good to each other.